Welcome to all of my Substack readers and listeners, and I'm really pleased to be able to introduce a fabulous person who, this is the first time that Jessica and I have actually spoken, but Jessica has been a very frequent contributor to the comment section of my Substack. Jessica has a Substack of her own, which is called Unpacking Truth, yes? And I'll put a link to that in the show notes for today. So Jessica Bishop Funk, which is a fabulous name, by the way. What a great name. Jessica is a dentist. And so reading her comments and just, going back and forth with her in the comment section, I thought that this would be a really great opportunity for me to talk to a dentist who has woken up, and to find out what that process was like. I have a lot of questions about dental school and your experience in practice. So when did you decide, Jessica? Actually, sorry, I have a question to lead in with. You have in your email signature, Psalm 34:14. Now, I did not grow up in a household where Bible reading was a common practice, and so I had to look it up. But tell me, what does Psalm 34 verse 14 say, and what does that mean to you?
Seek peace and pursue it. And to me, peace is knowing truth. And to know truth, you must pursue it.
Okay.
And then I guess to expound on that would be then to share that truth.
Yes. When did you add that verse to your email signature?
In the last about year and a half.
Okay. All right. Right. So this is very much a part of your waking up.
Yes.
So at what point in life did you decide that you wanted to become a dentist?
I probably have a pretty unique story. I grew up with a father who is a now retired dentist. And this is back before cell phones and video games. And on the weekends, in order to not get bored, I would go to work with him because he worked on Saturdays. That's not the trend nowadays. And I probably started working with him when I was like 3 or 5 years old. I would go in with him. I mean, I remember we didn't wear gloves. We didn't wear masks. I remember taking teeth out with blood on my fingers.
Ooh.
Remember mixing the mercury fillings with the little mercury pellets, rolling
and inhaling that as a small child.
Oh, yeah.
Whoa. Okay. Yep.
And then when I became a teenager, I knew I wanted to pursue something in health, whether it was going to be a physician or a dentist. And my dad's staff would time their pregnancies around when I would be out of school for the summer. So I had many a summer where I was covering for all 3 months because somebody was out on maternity leave.
Yeah.
And I really felt a passion for dentistry, I would say middle school to high school. Yeah. And so then I pursued it.
Okay. And what was dental school like? What do you remember of how you were taught? I'm particularly interested for reasons that won't be mysterious to you at all, on what was the teaching environment like? Were students just presented with, the facts on fluoride, the facts on amalgam, or was debate permitted? What was it like being a dentistry student?
I do not recall there being open discussions or debates on topics revolving around fluoride or mercury or any topic like that.
Yep.
In fact, as far as I can recall in dental school, I don't even remember there being a controversy around fluoride. The only reason I had any inkling that there might be a controversy is I grew up in a town in Pennsylvania, where we did not have fluoridated water. And my dad told me that it was because the town council thought it was a communist plot. So,
okay. I gather your dad did not think it was a communist plot.
No, not then, but we'll get to that. And okay. So if I had any idea that there was a controversy, the controversy was on the side of lunatics thinking that. And dental school was very, I want to say cookie cutter, and for a good reason, right? You have 4 years to cram all this knowledge or information in. And so it was really like, learn this, spit it out, and then get to clinic and do what you're told to do. And my experience there was interesting in that I had already worked in the private world for a long time. I'd seen a lot. And to know that what we were taught in dental school is often not how we do it in real world. It's just not applicable in the real world.
That's so interesting. So you went in there with experience of what dentistry was actually like,
Yeah.
and you'd learned it from your father. And so from a very well, from quite a young age, then you were presented with this mismatch between your lived experience, what you knew to be the truth, and then what they were teaching you. Yeah. Was that the first time that you'd had that experience, or had you experienced that earlier in in grade school or in high school, where teachers were saying one thing and you were thinking, no, I know that's not right?
I can't recall until 2012, I guess obviously sometime in dental school, I can't recall a situation where I felt like what I was being taught was the opposite of, what I knew to be true on a specific topic.
Yep. Gotcha. Okay, so this was quite. How did you handle that? Like, did you raise your hand and say that's not right, or what did you do?
Sometimes I had already, I was one to swim upstream. I was not afraid to
Yeah.
do things. And I realized that for a lot of my classmates who didn't have the same experiences I had had, there was a reason why they had to learn certain things in a sequence that may be too laborious in private practice. So there were times I didn't question, but there were certainly clinical settings where, with a faculty on a solo and a one-on-one interaction, where I would say, this just isn't going to work when we get out into the real world, for
And
practical application.
what was the response to that?
I think they recognized, and there was never too much negative pushback. And to their defense, who we're taught by are not people who practice in the real world. So, I would handle the topic delicately, just to say, I know my dad does it this way, and it saves time. It helps with the patient's comfort, things of that nature.
Right. And what do you think about that? The fact that dentistry students are taught by non-practicing, I don't know what you call them, non-practicing faculty, I guess.
That's right. So when I graduated from dental school, I went back for about 8 years and volunteered my time on Fridays to teach students in clinics so that I could help give them some real world application of what they were learning. And then I started having children, and then volunteering my time became mothering.
Yeah, absolutely. You found you didn't have a lot of spare time.
Correct. Yes.
Oh, what a surprise to anyone who's ever had children. Yeah. Okay. So you got through dental school relatively unscathed in terms of you weren't constantly in trouble for for disputing what you were being taught, and then you went into private practice, and so. At what point did you, like, I'm assuming that when you first went into private practice, you were doing fluoride treatments, and were you putting in amalgam fillings?
Yeah. In fact, I can you turn the thermostat down? I thought mercury fillings were the best ever. I preferred them over composite.
Yep.
And it wasn't until probably 10, 12 years ago when I really felt like I had a system where the composite being placed, I felt was doing a sufficient job. And I tell patients, even to this day, I don't place silver fillings anymore. But if a patient asks me which one's better, I really struggle with arguing in favor of composite. Composite is a plastic.
Yep.
Yeah.
Okay.
It's a plastic.
Yeah. So you have concerns about the components of it and their biological effects. Yeah.
And the longevity. You will never be able to place a composite that will outlast an amalgam. I'm not arguing in favor of amalgam. I'm just saying it is by far an inferior product, in my opinion, as far as its longevity. Bacteria loves a plastic surface. The decay that you find under a recurrent cavity under a composite restoration is, for lack of how to describe to a non-dentist, is extremely different than a cavity you find under a silver filling. The term we would use in our field would be bombed out, where the decay is just extremely aggressive. And some of that is mitigated by the mercury and the mercury fillings. The mercury probably
As an antibacterial.
Yeah,
Sure.
exactly.
Yeah,
So,
yeah.
so but I place composites. That is all I will do for a filling,
Yes.
because we don't have a better material. We don't have, well, yes, we do. We have gold, if you're
Right.
not opposed, but that's
Yeah.
extremely expensive and not practical.
Indeed. So at what point, what was the first common dental practice that you began questioning, and what prompted you to question it?
Gosh, I would probably say it would have to be fluoride. What, fluoride or wisdom teeth?
Mm-hmm.
I was glad you sent that this morning because I did want to talk about that.
Yes, wisdom teeth. All right. So
Yeah,
it was one of the two. Let's
yeah.
oh look, let's deal with wisdom teeth first, because the fluoride question is, well, yes, I'm sure you have a lot to say on that. So
I
let's
do.
jump into the wisdom teeth. Yeah. So the question that was sent to me by email, actually, was around, like, do wisdom teeth have to be routinely removed?
No,
Hmm.
absolutely not.
Yep.
And when I was trained, it was like, if they exist, they come out.
Yeah.
And then I would say in the last probably 10, 12 years, I've had a very different opinion on that.
Yep.
Because, and I tell patients, the longer you practice, the longer you do something, the more you have real world experience that teaches you that what you were taught doesn't always roll out, in what the patient experiences.
Mm-hmm.
And so I have a lot of older patients who have, I'm going to call them haphazardly positioned wisdom teeth that if they were 18 to 21 would have been, removed. But back when they were that age, perhaps they didn't have the means. Maybe
Mm-hmm.
oral surgeons weren't readily available. I don't know the circumstances that they didn't have them removed, but they've been able to be able to keep them clean and not have infection or
Okay.
inflammation or pain from them. And so even if they're not perfectly positioned or even in occlusion, which means they can bite, they're functioning fine for the patient.
Yes, gotcha. What was it that caused you to question this just, it's like a reflex removal of the wisdom teeth? Do
These
you remember?
patients,
Right. Okay.
yeah,
So you
that
were
was, I
actually
mean, that's
seeing
sort of the
people.
question.
Yeah,
Yeah,
you were seeing people in the
yeah,
real world who had these wisdom teeth, and they were kind of like, a bit oddly positioned, and yet these people were doing fine.
that's fine.
Yep.
Yeah.
Yep. Okay.
And then
How long ago was that, by the way, that you began
I would
questioning
say
that
10 to 12,
practice?
10 to 12 years. It's been a
Okay. Yep.
while.
Yep.
Yeah.
Mm.
And I
Mm.
tell my parents, people come in because I feel like we've trained the population. I don't know how it is in Australia, but I feel like we've trained the population. Like when you're 15, 16, start asking about your wisdom teeth. And, the parents are like, well, should they have them out before they go to
Yeah.
college? And
Yeah.
all this worry. And I just say, hey, let's just see what happens.
It is.
Let's
It
just,
is. It's very common practice. I wouldn't say it's quite universal here, but it's very common practice for people to have some or all of their wisdom teeth removed. And the argument that's always made is that if the wisdom teeth are left in, the remaining teeth will become overcrowded.
no.
And yeah, all right. Uh, so
Mm-mm.
when you were very adamant in saying no. Please explain.
Well, to the credit of the education that I received in dental school, we were taught there's just as much crowding that occurs in patients that do not have wisdom teeth as those that do. So that argument that you need to take them out because it's going to cause crowding is unfounded.
Yeah.
And
What happens? I mean, what happens to the person's overall health or their jaw development, their jaw function? What happens when you take those wisdom teeth out?
well, as I've started to study the airway, that's where I have become more concerned about this sort of universal removal of wisdom teeth, is that you then create an arch that becomes smaller because once those teeth are removed, as the bone heals, things are going to shrink. And that's your arch, that's your form, that's your framework for your tongue. And now your
Yeah.
tongue has less room. And so you still have the same size tongue, but a smaller house for it to reside in. And where does it go? It can only go posteriorly.
Mm, mm. I want to spend quite a bit of time talking about airway issues,
I
so
love
let's
airway.
bookmark that and come back to it. And so the two that where you weren't quite sure which of these ones you started to question first. The other one was fluoride. So when did you begin to have different thoughts about fluoride from what you were taught?
Well, I'm going to have to say fluoride is likely more recent. I can't pinpoint a time. I do know, and this is just, my own personal experience. Whenever my staff cleans my teeth, they're like, do you want fluoride treatment? I've always refused, not for any particular reason. I haven't had a cavity and I can't tell you how long, but just did. And then I think it was waking up in 2020 that helped me to really look at that topic a bit more critically.
Yeah.
And
Okay. Well, that you segued to a topic that I wanted to ask about. So let's make this explicit. 2020. When did you first begin wondering whether the COVID narrative was legit or not?
I had a very unique, I think, awakening. I fell for Fauci's lines, hook, line, and sinker.
Mm-hmm.
Held on his every word. Closed my practice for 2 months.
Oh,
And
so
I'm
you were really scared. You were very
I
frightened
wasn't.
about this.
Well, my husband and I were never scared. I was never
Okay.
scared. I just, did what I was told. I was being
Okay.
obedient.
Yep.
And I bought his mask lies. And even though I knew cloth masks were complete garbage.
Yeah. Let's get this on the record. Why do dentists wear masks when they're treating a patient?
So I don't spit in your mouth when I'm working on you.
Thank you for that. Yeah. Okay. So dentists wear masks to protect the patient against their own secretions. I presume that there's some like splash protection to
And protect us from you, right? From
yeah,
your,
from the
your
patient's
blood.
bodily fluids, like blood spurting out of
Right.
the tooth that
I
you
guess
just
it's the
removed.
other way
Okay.
around too. Yes.
Yeah. Okay. So in other words, dentists wear masks for protection against, let's just say, growth, as in, well, they are gross, but growth as in large size particles, blood
That's
and
right.
spit and stuff.
Right.
So when you were training as a dentist, and you mentioned that when you were working in your father's dental practice, you didn't wear masks at all. So, so I presume were you taught to wear masks when you were a dentist?
Yes.
And what were you told was the function of the mask? Was it this sort of splash protection, spit protection?
Correct.
Yep.
Correct.
Okay.
Never forgot. Yeah.
And did any of your teachers, lecturers, faculty, whatever, did they ever talk about masks with respect to viral illnesses or viral transmission? No. Okay. So in other words, every dentist should have known, did know, we can assume they knew that masks do not prevent the transmission of viral respiratory diseases.
Correct. And I knew that.
Yeah. Okay. So you knew that, but you said that you kind of bought the Fauci line on masks. What was happening when you look back on what was going on in your own mind? What do you see?
I was just unfortunately trusting an authoritarian figure.
Okay. Yeah, that's super interesting.
Essentially, because I figured he must know more than I know on this topic and kind of do as you're told.
Ah, that's really interesting. So you're a trained and experienced health professional, but in this particular matter, you assumed that the knowledge that you had was incomplete or was inferior because there was, a little tiny man who was on the TV an awful lot.
Yeah,
and he was appearing, at the president's shoulder at all those press conferences. We saw them here in Australia too, sadly. Okay. Yeah. That's fascinating. All right. So this is early months of the COVID-19 episode. I don't call it a pandemic. I usually call it a scamdemic, actually. But anyway, so this is the first couple of months you're going along with all of this. What happened next?
So then, we're going to say we're about 10 months in, around October timeframe, when there was discussion of a vaccine coming out.
Yep.
And I was pretty excited. I had nothing against vaccines. My kids had all of them. I knew there was some controversy around them, but never had delved into it. And our governor in North Carolina was offering an executive order for dentists to be able to be part of the rollout. And I was very intent to be part of the solution. So I was going to investigate what it would take for me to be trained to do so. And something that I hold very near and dear as far as what I provide for my patients is something called informed consent, which would be, what are the pros and cons of any given procedure, and allow the patient to make the decision. And obviously we kept hearing safe and effective from the mouthpieces. And grace of God, I don't know, but I remember the exact turning point. My mother sent me a video of Dr. Simone Gold.
Yep.
And I don't remember the exact one, but it was talking about the history of coronavirus vaccines. And it was, I call it, it's like finding out Santa Claus isn't real when you're a child. It's that sucker punch in your gut, like, holy cow.
Yep.
I've been lied to.
And this interests me greatly because your mother is a dentist's wife. Okay.
No, so that's right.
She's been kind of steeped in this professional milieu of, well, there are experts and they say things and we believe them and blah, blah, blah. Do you know how she came across? Like had she been questioning the narrative at all? How did she come across that Simone Gold video?
I don't. Well, she's part of an email listserv that goes out with a woman who directs these emails, and she probably has 600-800 subscribe, and not like Substack, but she has people that follow her.
Gotcha.
And she's about my mother's age, and it's a lot of conservative content.
Okay.
And so the topic, when this was becoming available, was shared. And, a little background, my parents have always been very much questioning government. So they had their scare as an older couple, worried about COVID, but then they kind of came to their senses a bit earlier than I did. And she shared that with me. And then that was just what, I don't know, the straw that broke the camel's back. I don't know how to describe it, but it was a 180 after watching.
Yeah, actually, I know you just said you don't know how to describe it. Could you describe it as best you can? Like, what happened? What was your thinking process? How did you feel when you watched that video and you learned about this history of coronavirus vaccines? And look, most of my audience is going to know this, but let's just briefly summarize this. So there has never been a successful vaccine developed for coronavirus in humans, in animals, and that's largely because coronaviruses mutate so quickly. It's also because of this problem of antibody-dependent enhancement that had popped up with previous coronavirus vaccines. So as a result, the fact that multiple separate companies all came up with a successful vaccine against coronavirus using a couple of different, we had the AstraZeneca and Johnson and Johnson or Janssen version, which was the viral vectored one. We had Pfizer and Moderna, and then particularly in developing countries, like India, and I suppose you don't really call China a developing country anymore, do you? But so in not Western countries anyway, they also developed coronavirus vaccines that were more traditional type vaccines, and all of them worked and were safe and effective. And you go, really? How did that happen? So yes, that's the background to this revelation that you had. So what happened to you?
I just went all in. I tend to, if I find something that interests me, I become extremely passionate on it.
Okay.
And I don't know when I started
rabbit hole, as they say.
Oh yeah, it was, and it is, and it's this is cliche, but it's like an onion. It just has layers, and every layer there's another layer, and it takes you from. We could go anywhere. We could go just about anywhere as far as just seeing the corruption and the lies behind what happened for COVID. anywhere from, I mean, if your viewers know where I'm located, I'm at the heart of where this started.
Say more
UNC,
about that. Oh, yes, University of South Carolina, Ralph Barrick
No,
doing his...
North Carolina, University of
I'm
North Carolina.
sorry. Okay,
Yeah,
yes,
North
yes, yes,
Carolina.
yes. All right, yeah. So
Yeah,
Ralph
and that's
Barrick, who
and his
develops...
lab was right across the street from where I went to dental school.
Oh, boy. Okay,
Oh
so
boy,
you really were like in the belly of the beast.
the belly of the
Yeah.
beast. Yeah,
Okay, yeah.
yeah.
All right. Right. So, what happened to you, as a person, as you were peeling the layers off the onion? Like,
It was
what happened to your relationships, your sense of,
it's
all that?
painful. It's
Yeah.
painful. So, we're talking the end of 2020 when I woke up, and then you just can't get, I mean, if I could show you the stack of books I've read and articles, I mean, just could not peel me away from reading, to the point of, neglecting my family on some level because I was so intent to learn.
Yeah.
And I became vocal. North Carolina, the state, has a state dental society, which I'm part of, and maintained for us as a forum for us to communicate with one another, that you can, respond to certain communications, and anybody who's part of it can view and read, or also add in, chime in. And as the vaccines were being rolled out, there were dentists trying to cut in line. We were considered not to be top tier, and they were trying to, complain that we weren't top tier and how much we're at risk. And if we don't get vaccinated, we're all going to die. And I couldn't keep my mouth shut much longer. So I started chiming in. And then I just got annihilated by my peers.
Yeah, so this is online interaction with fellow dentists. Yeah. And so you got annihilated. What was their response? What were you receiving back?
I was one saying, hey, we've practiced, now 10 months. Nobody's died in the dental field from it. I said, we can wait our turn. Let's let the most vulnerable have their hand first, and then as I got bolder, I would, express concern over the safety issues, the lack of long-term, knowledge of side effects or harm. Does it actually prevent you from getting coronavirus or transmitting it? And so then, I mean, that was just more than they could handle. So I got called tinfoil hat wearing. I was told I needed to have my credentials taken away.
So ad hominem attacks. But did anyone actually present information that rebutted you? No. Okay, so it was purely ad hominem attacks. You're a tinfoil hat nutter, you're a conspiracy theorist, you're not fit to practice, but no one would actually engage with you in a discussion in which you both brought your evidence to the table.
Yeah, so like the prime example was a time in the summer of 21 when it was before people were being forced to be vaccinated. A dentist in North Carolina was ready to fire a staff member for not getting the vaccine, and her position was that she had already just recovered from COVID, so she had natural immunity.
Yep.
And the dentist wanted to know the position of, the dental society, the larger umbrella being the American Dental Association. What is the position as to whether or not I should fire the staff member? And I'm sure you've seen the study. It's an older one. It was small, but out of Kentucky, that the CDC had done on some, 260 subjects, that said, oh, vaccinated immunity is superior to natural immunity. That is what they
Yes. And hybrid immunity, that's this new invented term. Yeah.
And that was the straw as far as being quiet much longer on what I knew and what I had researched. And so I wrote back with research from Nature, Cell, BMJ, on
there's a stack of papers this high on just how protective natural immunity is. Yeah.
And my post was never posted.
So that means your profile was already being watched,
censored,
I presume. Yeah.
And so I emailed the moderator and I said, where's my post? And she's like, oh, well, that's misinformation. So then,
So let's just make this really explicit for the audience, right? You submitted medical papers, like you referred to medical papers
yes,
published in top tier journals. I mean, Cell, Nature, these are top tier journals. And you were told that your post would not be published because it contained medical misinformation.
yep,
That's pretty rich. Okay.
yep.
So what did you,
And
and who was the moderator, by the way? Like who are these people? Have you ever been able to ascertain, like, who are they? What are their qualifications? Who pays them?
well, I mean, these moderators are employees of the North Carolina Dental Society, so they are, they're in the early 20s, maybe 30s,
Right.
staff members who
Like
just
disinformation experts.
yes, yes.
Who have like a BA or in journalism or something. Yeah. Okay. I get the picture.
And I was really disenchanted because at the top of our forum it says Open Scientific Forum.
Yeah.
So before anything you see, that's what it says at the top of the forum. And so
Okay.
I wrote back to the forum and in a separate post and just said, how can we consider ourselves a scientific forum if we can't even, discuss science? And
they published that one?
they did. And then people were like, whoa, what's being censored? And then the original post got posted.
Oh.
And that's when the onslaught of attacks came. Yeah. But it didn't stop me from posting. I continued to post then.
You had a fire in your belly.
I did.
Where did the fire come from? Like, because it sounds like you had been a pretty good girl.
Seek peace and pursue it.
Okay. Yeah.
Yeah. I mean, how can you sit back and watch people be harmed?
Well, yeah. How can you? I mean, I'm assuming your colleagues. Have you had any conversations with them? Right, because this is a question that torments me. How is it that people who enter the health field broadly, I'm talking doctors, nurses, dentists, physiotherapists, whatever, that all these professions where the main object of these professions is to help other people. It's to help them make their lives better. It's to help them get out of pain, solve their illnesses, like whatever the heck. Psychologists too, I forgot them. So all of these people are witnessing harms and they're doing nothing to intervene. Do you have any sense of how it is that they do that? Like, how is it that you and I can't sleep at night if we don't speak out? But they're okay with that.
Well, I think there's two camps of people to describe what you're asking about. And that is, you have the camp that just will bow to authority because authority has told them and they're not going to question.
Do you think that because they have that mindset, and I agree with you, by the way, do you think that causes them in a very literal way to see the world differently to you and I? And I'll give an example to illustrate. So I am seeing an increasing number of people in my practice who have been diagnosed with unbelievably aggressive cancers. Horrifying case. The woman, I spoke to her just before Christmas. She rang me from the hospital where she was, in bed with God knows how many tubes stuck into her. She was about to be transferred to palliative care. Long story short, she was diagnosed with stage 3 breast cancer. She felt a lump. She goes to the doctor to get it checked out. Yes, you have breast cancer. And in the process of scanning her, they found that she actually had stage 4 lung cancer that had already spread to her brain, her liver, and her bones. Right? And this is a woman who was a Pilates instructor, followed a healthy diet. She had formerly been a smoker, but she quit a long time ago, right? And I've never seen this before. I can reel off half a dozen cases like this.
Oh, I had pages. I was keeping notes on the cases that I was seeing because half my staff is awake. And when we were doing medical history updates, never in my 22 plus years of doing this have I seen such a decline in the health of patients from the aggressive cancers that you're talking about, to what I've seen more of are cardiac issues. And it's probably because I'm a dentist, so I'm not going to see the cancer patients or talk. They're not going to be in to see me, but all AFib, it's like every other patient, and that's an exaggeration, but that's what it feels
you're
like.
seeing a sudden uptick. So okay. Do other dentists do medical history updates, like when they get a patient back in?
Oh, yes. I mean, I don't know that all do, but we're supposed to. We're trained to do very thorough.
So this is standard practice. If you're a
Correct.
dentist who's worth your salt, when a patient comes in to see you, you do at least a quick check-in.
Yes,
have you been diagnosed with anything since the last time I saw you, or whatever. And obviously, you'd expect people to be doing this with new patients. So other dentists are seeing what you're seeing, but they're not seeing it the same way as you are.
Yeah.
What do you have any insight into? Like, are they just bought into this idea that it's all long COVID, or what are they thinking?
I think I speculate that it's because once you become awake to this, your whole world changes. Your profession has lied to you. Everything you've studied to become has lied to you. And going back to those layers, as you peel back the layers that they lied to you on the vaccine, what else did they lie to you about? The origin of COVID? What else? Every pharmaceutical drug that's been poorly tested. I mean, the list goes on and on. It's painful. It's painful to become aware of how much you've been misled, and so your world gets rocked, and that's a hard thing.
I'm glad you raised that, because I personally think that pain of the word that popped into my head was discombobulation, but it's so far beyond that. It's a total disorientation, isn't it?
It is.
And I went through that much earlier in 2020. Sorry, this is not about me. This is about you. But from the get-go, I knew there was something really, really sus about this. But I had no idea how deep that rabbit hole went. Right.
Yeah.
And as I started trying to figure out who is behind this, why are they telling these lies? Why has well, I know every country, at least, no, every country that is a member of the WHO has essentially a pandemic preparedness plan. And I came across Australia's pandemic preparedness plan fairly early on in the piece. I can't remember exactly when. It was maybe a few months in. It was updated in August of 2019. And it laid out what Australia was supposed to do in the event of an influenza pandemic. Now, yes, it was supposed to be a coronavirus pandemic, but what the hell? They're both respiratory tract infections. Exactly. The mode of spread is the same. So the response should have been the same. And the response was completely counter to that. And so I started asking these questions. Why? Who is behind this? Why are we seeing every other country whose pandemic preparedness plan read much the same as ours? And I know that because I read quite a few of them. And they said much the same as ours. And the WHOs said the same as ours. So who is behind this? And that's what led me to go, really, really deep into it. And so I know this pain that you're talking about, this sense of utter betrayal, that every institution that you just assumed was working more or less for the public good, and maybe there were a few corrupt people, but the institution was solid, and the majority of people working in that institution had the public good in mind. And yes, there was the occasional scandal, but they got found out, and the people who were responsible for that scandal got rooted out. No, that's not how it works at all.
Yeah.
So was your family going on this journey with you? What were your kids saying? What was your husband saying?
Well, I feel grateful that my husband and I he probably woke up a little bit before I did. I don't know. It was, he might've been more, he's sitting here next to me. He might've been more skeptical. But once I watched that video and then I started doing my research, it was, he and I were completely aligned, as were my mother and father, and as were my siblings.
You are so very, very fortunate.
I know. Trust me, I count that as a blessing. And then, I had told my staff, I said, I didn't want them to take the vaccine. I said, this has not been tested well enough. I am very, very leery of you doing it. And half did and half didn't. And those of us who didn't have just been, constantly in communication about, them thanking me for not forcing them, for sure. I mean, that as they learn or see family members who've been harmed are very, very grateful that it was never an issue of their employment to take the shot.
And so, when you say your staff, do you work in a solo practice or a group practice? Yeah,
I'm a solo. I'm the only doctor, and I have nine staff members.
Okay, so you have never had you've never had clashes with co-workers. Your clashes with fellow dentists have been in this forum. Yeah.
Correct.
Okay.
Yes.
Okay. Mm-hmm. I don't know whether you know this, but every health professional in Australia was mandated to have these, I don't call them vaccines because they're not. So if you wanted to work as a dentist or a chiropractor or a nurse or a GP or psychologist or anything, you had to have this toxic concoction.
My husband and I had, I became concerned that it would be tied to my ability to renew my license to practice dentistry. Mm-hmm. And I had told him that I would quit. I would not be putting this in my body. And if we had to sell everything and clean toilets, mm-hmm. I felt so strongly after I had done my research that this was not for me or my family.
You mentioned informed consent, which was absolutely trampled all over. As a dentist, what was your training in terms of informed consent procedures with patients?
It was huge. It was a good bit of time was spent on this. Yep. Informed consent, and then having patients sign a consent form to treatment. That was part of every single procedure we did. Mm. Huge.
And spell out what informed consent means. Again, I know my audience knows this, but let's put this on the record. So informed consent means you mentioned this briefly, but let's really dig into this. So informed consent means that you explain to the patient the procedure that you intend to do, and you explain the benefits and the risks. Yes. And
options. That's the other key. RBO, risks, benefits, and options. What if I don't do this? What are my other options?
Yes. So what are the alternatives? If you do not wish to have this procedure, you could do this or you could do this, and you could also do nothing. Right.
Correct.
So that's what informed consent means. And then after you've explained the benefits, and you might truly believe from the bottom of your heart that this procedure is absolutely the best thing that this patient could do, and that they are seriously jeopardizing their well-being if they don't do it. But the decision is theirs.
Absolutely.
And that's the consent part.
Absolutely.
And so as a dentist, you were trained to give informed consent. For those staff members of yours who did get a COVID injection, did they receive informed consent?
No, because nobody could. There's no informed consent, and it wasn't necessary.
Was there even a pretense of it? I mean, have you spoken to them about what actually happened when they fronted up to any kind of vaccination centre, or they went to a pharmacy or a doctor or whatever? Was there even a pretense of informed consent?
Well, I don't know that I've asked them specifically, and if I have forgotten their answer, but I will say that based on what I know happened in this country, because of it being under EUA, informed consent is unnecessary. It is, that wasn't offered to patients.
So this fundamental tenet of medical ethics, dental ethics, any health professional's ethics was trampled all over.
Completely trampled. Yep.
Yeah. And health professionals like you who were trained to give informed consent just waved that on through. Didn't have any objections to this because it was an emergency.
That's the part I can't wrap my head around. And I'm sure you feel the same way as you asked about relationships, and not necessarily relationships I specifically have with people, but to know people who are far smarter than I am, have many more degrees, who continue to fall for this lie. It just calls into question, how can you not be observant to what is actually happening? How can you still be blind right now?
Yes, especially in the context of the significant increases in excess deaths. Yes. I know you have them in the US. We've been running it at percentages of excess deaths that haven't been seen in this country since the Second World War. This is happening all over the world. Yeah, we mentioned the cancers, the cardiovascular complications, the neurological issues, the autoimmune issues. How can they be seeing all of this and still buying the line? Anyway, that is a question that I suspect will haunt me to my grave because I don't know how this happens. So, do you do you have contact with other dentists?
So during the shenanigans that were occurring on the forum, I had several reach out to me personally to applaud my efforts, and support my sharing the information. And
But they would contact you privately.
oh yeah,
Not on the forum.
yes, correct.
Okay, this is fairly
The forum was an ugly place. It was
Yeah.
it was just a very unprofessional. It's embarrassing to even know that others in this in this profession would behave in such a manner on a topic that was evolving.
And of course, as you know, medical doctors have reported exactly the same thing. That
correct. Yes.
their supposedly professional colleagues behaved in the most unprofessional manner imaginable. And yeah, I saw it absolutely everywhere. Absolutely everywhere. Yeah. Okay. So this was happening online, but in person, what?
Several reached out. I probably had, I don't know, maybe 24 reach out to me personally, and then a half dozen of us, we formed a sort of a separate dental society called the Socratic Dental Alliance, where we would meet weekly. We wrote a 40-page white paper to the American Dental Association on our concerns of how the dental profession handled COVID, from the lockdowns to the masking to the lack of sharing what we could have done to mitigate better by, advocating vitamin D, vitamin C, zinc, things that would have helped support patients' immune systems. And so we worked on that together. We've done a lecture, and then we met up with a larger group called North Carolina Physicians for Freedom, which is a large umbrella, if you will, because you have chiropractors to pharmacists to physicians,
Right.
to dentists.
As a multidisciplinary professional group.
Correct. So we all of our circles kind of started blending, and our efforts were then put to better use with a larger group to work towards medical freedom in our state.
Yeah, and so it's been revealed, mostly through FOIA requests, I believe, that that very generous sums of money were paid to medical professional associations to basically speak the government line. Was the same true of the Dental Association at either federal or state level?
I assume, and I tried to get to the bottom of that as we were doing our research for our paper, because not specifically as it related to COVID, but we were just so amazed that we were in lockstep with the narrative. And I say we, the American Dental Association. And beyond the dues that we pay annually, we could not get to where the rest of the funding, what the source is for the rest of the funding. That was not readily available in the sources that we tried to. I'm sure if we pressed hard enough, we probably could. It just comes down to time. And we did not get that information. But I guarantee that the American Dental Association on some level received funding that would have us be in agreement like we were.
Yeah. What does that make you think about? The fact that these very large sums of money were doled out to everything from, well, definitely the AMA, the individual colleges. Like I know the College of Obstetricians and Gynecologists got paid a lot of money. James Thorpe talked about this, and so we don't know. Let's make this clear. We don't know whether the American Dental Association received a big lot of money from the government, but it's fairly safe to assume. So, where does that lead you in your thinking?
Well, for the first time in I'm on my 24th year of practice, I did not renew my membership to the American Dental Association. So it's not a small fee to be a member annually. And I do not want to be part of an organization that is so easily bought. I'm happy to pay dues. I'm happy to pay dues to something, but not when the best interest of those we serve is not being recognized.
And yes, I mean, the best interest of those you serve, but they weren't even standing up for dentists or anyone else involved in the dental profession if they were willing to jump on board with that ludicrous CDC non-study about the superiority of immunity to back the firing of dental staff who didn't.
I don't know this, but I would think in large part if the majority of dentists thought like you and I did, and we pushed back, but I know I am a severe minority within my profession.
Yeah.
So
do you have any sense of 5%, 2%, 10%? What percentage of dentists do you estimate are actually?
My husband thinks 1%. I was going to say 5%, because I know we have organizations like the IAOMT, different sort of holistic dental arenas that were wide awake, and that's where I have felt I have made some, alignments with. Others.
Okay. So there are fellow travelers.
Yes.
I'm glad you raised that. I'll come back to that in a moment. So you can actually practice without being a member of the American Dental Association.
Yes.
Yep. Mm-hmm. Okay. So we're now in late 2020. Your eyes have been, opened wide. You're starting to question everything. Let's talk about fluoride. So what prompted you to look into fluoride?
I wish I had saved the communication, but I would say it was sometime in 21 or 22. It would either be late 21 or early 22. There was some communication that I received from the American Dental Association. I believe it was by way of email. And it was alluding to the NTP meta-analysis, the National Toxicology Program. I'm sure you're aware of what's happening.
And this is being brought to the fore by the Fluoride Action Network's case against the EPA. Correct? Is that right?
I believe the EPA is part of it. And I'm sorry, is that my phone? Is that bugging you? Can you hear all that?
I can hear it dinging, but it's fine.
I just don't know how to turn it off. So you can turn my phone off or I'll come to my computer. So the communication was written in such a way that expressed concern for the information contained in this analysis to be widely distributed and might be concerning to the public.
Okay.
And after the whole COVID debacle, I was like, well, what's in this meta-analysis? What did they find? Because
so in other words, you get a communication that says, hey, this thing's going to be out, many people in the public will read it, they might come into you as dentists with questions about fluoride, and what was it like, and here's the spin, like here's what you're supposed to say to
no, I don't even remember going into that much detail. It just said, because at this point it wasn't broadly available. I don't know if you're familiar, but basically the ADA, the American Dental Association, received sort of an early viewing of the report before the public, even before the nonprofits were allowed to see it, is my understanding. And I'm believing this communication was aired to us before the report was more widely distributed, as saying that this, what the findings of this report will, give the public some concern as to the procedure of fluoridating water. And I think more broadly than patients may question fluoride treatments, which.
Gotcha. Okay. Which is obviously, such a central tenet of dentistry, isn't it? That we need.
Yeah. Well, I think I said to you.
Yeah.
I said vaccines are to medicine as fluoride is to dentistry.
Yeah. I mean, that comment just kind of really struck me as utterly true. They are both. There is an element almost of sacrament to those two practices, isn't there? Like their rituals and the reputation of the medical profession rests very heavily on the notion that it was vaccines that eradicated the scourge of infectious disease, that meant that parents didn't have to lose every second child to infectious disease or whatever, which of course is complete bunkum.
Correct.
And similarly, the dental profession kind of rests on this notion that, people have much better teeth these days. Look at those old photos of people with missing and decayed teeth and black teeth and whatever the hell else. And now we have fluoride and it's great. And I'm your friendly dentist. And I'm going to, advise you to use a fluoride containing toothpaste. I'm going to put this gel on your teeth. Yeah, it's all wonderful. So you get this communication. You go, hang on a minute. What are they hiding from me now? Yes. and what happened next?
That's exactly right. And so then I started reading, and I believe about that time, Epoch Times or Epoch Times, I'm not sure if you're familiar with that communication.
Yeah, absolutely. They've done fabulous.
They had a pretty, I would say it was 7 or 8 part series on fluoride. Yeah. And then I read in this book. I have literally studied the case against fluoridation by Paul Connett, and his son Michael Connett is, working with the Fluoride Action Network now. Del Bigtree had Michael Connett on the High Wire. I don't know if you saw that.
I saw that episode. Fabulous. Yeah.
Yes, Christopher Bryson's book, the fluoride deception.
Yep.
So I just started diving in, and I wanted to read in depth on it. And I would say the case against fluoridation is, it's kind of like when I don't know if you've read Turtles All the Way Down, about written by the 2 Israeli physicians on
childhood vaccination or vaccination in general. Yes.
Yeah, it's very similar to reading that, in that once you read it, you can't unsee what you've read. You can't unknow it. And it's a challenge to, obviously accept the fact that I just finished writing a newsletter to my patients, and we'll send it out probably in my Substack on it, that, I just trusted. I just trusted what I learned in dental school, never questioned, and then when you start doing your own research and you can think more broadly on it and be concerned that, wow, we continue to do this.
Yeah, indeed. And I sent you an article yesterday that was published by an Australian kind of independent media outlet about the renewed push to get more local councils in the state of Queensland, which is where I live, to fluoridate their water supply. So Queensland has the lowest rate of fluoridation of water supply in the country. I think you'd probably sort of characterize Queensland as being somewhat like the Texas or these days, I guess, the Florida of Australia.
Good analogy.
And interestingly, there was, I'm from Sydney originally, which is in New South Wales, and we had already moved to Queensland a year before the scandemic, and then as a result of the scandemic, we thought, my God, we haven't gone far enough, so now we live in rural Queensland. And it's interesting because there was an influx of people from the southern states, from New South Wales, and in particular from Victoria, and particular from Melbourne, during the entire scandemic. The local real estate agents could not believe what was happening. They would just have people from Melbourne phone up and say, what properties have you got? I'll buy it. Right? What are you asking? I'll offer 10 grand more. So there's been a massive influx of people into the state. And so that shifted the demographic somewhat. But anyway, long story short, so I sent you this article on fluoridation in Queensland, and it was a decision that was handed over to local councils some years ago. I don't remember exactly when, and a very large percentage of councils, especially in the more kind of rural and regional areas, basically said, well, we're not going to do it anymore. So now there's renewed pressure on them, but basically to take this decision out of local government's hands. And to put it in the hands of the state government, which really is not representative of the vast majority of people who live in this state. So the fluoride controversy, which I've actually covered in my Substack to a small degree, is essentially that consuming fluoridated water has been shown to lower IQ in children, and it's only a couple of points, but population-wide, this makes a heck of a difference to the to the capacities of of the population that has consumed fluoridated water. Well, I was going to say since birth, but actually it's pre-birth as well, because if the
That's
mother's
right.
consuming fluoridated
That's
water, it
right.
goes into the fetus. So there's that side of it, and this case that's been ongoing in the US has revealed that the EPA. Actually, do you want to take over, because this is more your subject matter than mine? So, do you want to just describe briefly what that case is about, what the evidence presented has been, and what the EPA has been up to in terms of burying the results of their own findings?
I don't think it's just the EPA. I think the NIH, as a broad umbrella of the NIES, and then this National Toxicology Program, the NTP, are all involved on some level. My understanding is that, and I don't know if it's the same in your country, but we fluoridate. This is the most disturbing part to me, is what we actually fluoridate with. And that is the toxic waste from the mining of phosphorus rock for the fertilizer industry, hexafluorosilicic acid. And once that hexafluorosilicic acid in this country, it's sold, this toxic waste cannot be dumped into the ocean as far as international law or international agreements. And it cannot be dumped into waterways in the US. The industry would have to pay large sums of money to dispose of it properly. But if the government purchases it to put it into the water system in this country, the EPA essentially gets to wash its hands of what is in this toxic soup before it goes into our water. And as far as the EPA's specific involvement with this information coming out, I don't know which of the alphabet agencies is truly holding up. That part I haven't been able to ascertain from what I've read mostly through the Fluoride Action Network. And I follow that information coming out, as far as this lawsuit, because it's been in courts now for a couple of years, where the government is dragging its feet, bringing the final report, making that final report available. But basically, a summary is that there are some 50 plus studies that point to the correlation of a decreased IQ with fluoride consumption, varying degrees of fluoride consumption. And
it's a dose response relationship, right?
Correct.
It's like the higher the exposure to fluoride, the
dose
more
makes
substantial.
The poison.
Yep.
And as we're going back to informed consent, well, here we are. We're basically forcing a medical treatment on every living being that drinks municipal water if you're not on a well, without the choice to make the decision to decline. And for what we can tell right now, its neurotoxicity seems to be most dangerous for the youngest amongst us, from fetus to, I'm going to say, till about 5 years of age, the developing brain. And we had somebody, my dental group, we had somebody from the Fluoride Action Network join us for one of our meetings that we had to discuss this. And this is pure speculation on my part, but because it's neurotoxic, I wonder if fluoridated water has any bearing on this increase in autism that we see in our country, that in combination with the potential link to vaccines, is there the absolute load to the child of toxins that the body can just not take that last straw, if you will, that sets the brain off into
yes.
And
in other words, autism is very complex. I have no doubt that it's multifactorial, and fluoride is one of those, or is likely to be one of those contributory factors. It's a very potent neurotoxin. Does fluoride have any physiological role within the human body?
Well, that's the part that I think is, as this, what I wrote today, I closed with, what we don't know. There are many systems within the body. It's naive of us to think that somehow fluoride benefits the teeth yet has no impact on the rest of the body. It just goes in, it just goes right to the teeth and doesn't affect other.
Because when does that happen with any other substance? Yeah.
Right. And the thyroid has been implicated, the pineal gland, reproductive organs, the kidneys, the bones, the joints, all these things. There are studies out there albeit small, and not a number of them in animals, but there aren't resources to do large studies on something that there's no financial gain for anybody who were to, try to do, say, a 20-year study on somebody who doesn't fluoridate versus somebody who does drink fluoridated water.
It is entirely possible to do that. I mean, Australia has a much more centralised healthcare system than the US. I mean, basically, when you're born in Australia, you are enrolled into Medicare, which is our single payer health insurance scheme. And because we do have, particularly in Queensland, these communities where there's no fluoridation in the water supply, it'd actually be a very, very easy thing to do like large population-based studies to see, okay, what is the rate of this disorder and that disorder and the other disorder in these fluoridated communities versus these communities over here who don't have fluoride. In the same way, it would be a very, very easy thing to do to compare the medical records of people who are being vaccinated, because the Australian childhood immunisation record similarly is linked to Medicare records in this country. But our government officials and health department officials just flat out refuse to do that study.
They won't do
it's
it.
a very easy study for them to do, and they won't do it. And the fact that they will not do it, the fact that we do not have these data when the circumstances exist to gather them and to analyse it, speaks volumes.
Absolutely.
They don't want to know, or they already know, and they don't want the public to get actual proof. Now, so it's really beyond doubt at this point that fluoride is a neurotoxin. Does it strengthen teeth? Does fluoride, either applied topically or consumed, in fluoridated water, does it actually reduce the risk of tooth decay?
What I had read in this case against fluoride is when they were doing these studies, the information is a little murky, and I would say, and they were unblinded, and so the researchers would be somewhat, I'm thinking the words just slipped my mind, but are going to be favoring, those who've been exposed to fluoride, and there's a gray area in diagnosing decay. Not all dentists agree. You can give, you can put a set of x-rays in front of 10 different dentists, and I joke with patients, you're going to get 9 different treatment plans. So I struggle to truly comprehend and appreciate the potential benefit that fluoride might have. One paper that I had read this year last year had talked about how, yes, fluoride does strengthen the enamel, but only in the first 0.6 millimeters of the enamel surface. So you get this really tough, hard shell. But if a cavity has started beyond that 0.6 millimeters into the next layer, into the dentin, then it just goes like wildfire. And when I read that, I was like, wow, that really explains some of these cavities that I open up where radiographically they didn't look like much. And then I get in there and it's just, it's a shock. You're unprepared.
This seems very analogous to me to the situation with bones, because as I'm sure you're aware, fluoride was used for a while. It was certainly experimented with to try to reduce bone fractures. And it turns out that fluoride does indeed harden bones, but it actually makes them more brittle and prone to breaking. And I mean, bones and teeth are not exactly the same, but they have a lot of similarities. And so that would make sense to me. You're making teeth hard but brittle? Or,
correct.
Yeah, okay, that's how you'd see it too. Yeah, all right. So when people go to the dentist and they attend for their, once a year or twice a year checkup, and actually I want to ask you whether you think that that's necessary or a good idea or what, but so again, we'll bookmark that and come back to that in a moment. When people go to the dentist for their checkup, their general clean and whatever the heck, what do you suggest they say to the dentist? Because, and this was one of the questions that was submitted, and I relate to this. Go along for the checkup, and the dentist is like having a poke around and cleaning this, and then they turn around and they come back and they're like painting your teeth with this fluoride stuff. Like, whoa, hang on, what are we doing here? You didn't explain this. I didn't ask for this. I want you to stop. Don't put this fluoride stuff in my mouth. So what should people do when they're going to the dentist?
Well, you should be asked. Nobody should ever put that in your mouth if
Yeah.
you've not been asked first. You should be able to give informed,
I can't recall ever being asked by a dentist.
Oh, well, we've always asked, and I have never.
That's interesting.
It's been beaten into us in dental school that when patients deny treatment, certain treatments, that you're supposed to put the fear of God into them and have them sign a form that, I'm exaggerating, but
informed consent under duress.
yeah, and you won't be held liable for their teeth rotting or whatever. And I have just never felt comfortable with pressuring somebody into something that they didn't want. So my position before awakening to all of this was always just to respect the patient's desire or lack of desire for, and I'll even say x-rays too. I would include x-rays in the same thing. That has just been how I practice. But I would say in practices that are less individualized, like mine is, because it's my practice, where you have a group practice, or what's become rampant in our country is the corporate practices, where the dentist is just an employee of the company and you have to do certain things because that's what you're being told to maintain your job. You're going to have a very different experience. So for patients like your readers had asked questions, I would say my advice would be, and I don't know if it's available in your country, but would be to seek a solo practitioner or a practitioner who's in with
it definitely is available.
Yes. Yeah. And hightail it out of there if a dentist does not honor your wishes. That is not a relationship that you're ever going to feel comfortable with. And that is something I sort of beat into my patients, is this is a relationship, and this relationship is based on trust. And if you don't trust me, then
trust and
we're
respect.
not. Yeah, exactly.
So when a person goes to book their appointment, they should probably say at the time of booking, I don't want fluoride treatment, thank you very much. And then repeat that to the dentist when they first get in the room. Good morning, I don't want fluoride.
Yeah. Well, in our practice, the hygienist asks the questions at the beginning of the appointment, and that they decline. There's no further discussion. So yes.
Okay. It's entirely up to them.
And I'm not at a point yet, I'm slowly evolving into the space. I have not taken it out of the practice yet. I still respect a patient's desire if they feel it's benefiting them because of the topical application. I don't know what we have versus sort of the hydroxyapatite, but that's not widely available for us to do a localized treatment for a patient that has a high caries risk. So I don't know. I need to do more research. I need to find out what I'm comfortable recommending and that what I feel will actually have a benefit for the patient.
Yeah, and the hydroxyapatite is a form of calcium phosphate, which is actually the building material of the teeth. But
of the teeth themselves, that's right.
Yeah, it's basically the form in which calcium phosphate occurs in the teeth, right? Yeah, and so there are toothpastes containing hydroxyapatite.
That's right. That's right.
Yeah,
using that as a remineralizing agent.
Yep. And it should also be pointed out that the teeth are there is an inherent remineralizing process, correct?
Correct, from your saliva. I mean, your saliva is constantly at work doing that.
Yep. Okay. So this. I realize I've been talking to you for over an hour, and I haven't.
I know, it's been wonderful.
Okay, and I've so enjoyed getting to know you, and I know that you're very passionate about this topic of airways, and I believe that the issue of remineralizing is somewhat connected to the airways issue, correct?
Absolutely.
Yep.
Well.
How about we do it this way? Because I want to get you back on if you're willing. So
I would love.
Could you just very briefly summarize this issue of airways, how it relates to standard dental practices and to dental health more widely? And then when I get you back on, I'll let you off the leash and you can go full tilt into airways. How's that sound?
Okay. Well, so the first topic that I would think of when discussing the airway would be sleep disordered breathing.
Yep.
And which you may more commonly know as obstructive sleep apnea. And
how common is that in America?
I'm going to say I think I've read somewhere around 30% of the population may suffer on some level.
Okay. Yep.
Possibly even higher. Okay. It has to do with the ever growing weight that I'm sure you have the same thing in your country as we do
100%.
here.
Yep. We're not far behind you.
And not learning how to breathe properly. The book I'm reading right now, and this is awesome. It's called The Oxygen Advantage. It's all about breathing properly and how to breathe. And it's just amazing what we just take for granted. We might talk about what we eat and what we drink and how much we exercise. But what's the basis of life? And that's oxygen. But going back to the airway, sleep disordered breathing and obstructive sleep apnea is going to have a twofold impact on the oral cavity. And that is, one, you have your mouth open. When your mouth is open, you're drying out. And that dryness, you don't have your saliva working. But in an obstructive event, if you've ever watched video of a patient having an obstructive event, you'll see the whole entire chest just heave. And the stomach contents, as they're heaved, are kind of pushed back up into the oral cavity. And so one of the things that we'll see is an acid demineralization on the lingual or the tongue side of predominantly the maxillary teeth, as far as having impact on breaking down tooth structure from
so this is upper jaw. Their own acid is coming back up in the midst of these apneic episodes, and then so it's a two-pronged attack on the teeth. It's the mineral being the teeth being broken down by the acid, and then the remineralization that should be taking place during sleep is not happening because their mouth is open.
Correct. That's right. That's right.
Okay. Yeah.
And and then as you've studied airway, it just becomes a snowball effect, or a chicken and the egg, which comes first with the weight. And then when you're not sleeping well, then your diet changes and your body doesn't know when to be full. And then you're eating more carbs and more sugar, which is bad. And it's a never ending cycle.
Yeah. But it's actually an amazingly profitable cycle, isn't it? For certain professions and for certain industries.
Obstructive sleep apnea, or just the weight in general?
The whole cycle that you've
described. Whole thing. And this is where, passion, I know we need to wrap it up, but this is where I have, I can test patients in my practice for obstructive sleep apnea. As a dentist, I'm not legally able to diagnose anybody, but I work with a sleep physician. But what I see in this country, and I'm sure is in your country, as you said, profitable, and I just want to touch on this, is that we immediately press patients into CPAPs, the positive air pressure machines to sleep with. There's a ton of money to be made off of those. But there's so much we can do for patients. There's so much through proper education. And that's where my focus is. And I'm going to take you from the bottom and then we'll work up. Let's try some conservative, cheap measures, from taping your mouth shut to wearing something that keeps you from being on your back, because predominantly it's a postural. So if you can sleep on your side, you'll see less sleep apnea. And there's so many things to help patients. And my frustration has been that people will deny being tested and deny any treatment because they think they're immediately going into a CPAP. And what we need to do is bring awareness that there are a lot of ways we can help you, short of you having to be tethered to a machine like Darth Vader or whoever he is.
Yeah. Look, I am your father. But by the way, what do CPAP machines do to people's dental health?
Well, what I see, so you first, you kind of recognize it right away because they have their strap marks are still on their cheeks, 8 hours later from being tied in. But if, some of these machines, if they're just wearing a nasal cannula, they can still have their mouth open, so I still see the dryness from their CPAP machine. I even think the full face masks, I usually can tell who has a CPAP. I will ask, I'll inquire based on some dryness in their oral cavity and how their teeth look.
Gotcha. Okay. All right. I need to have you back on. So thank you so much for your willingness to share your own journey. So I want to wrap up with two questions, really. What would you say, if you had the attention of your fellow dentists who are still going along with the mainstream line about COVID, what would you say to them if you could have their undivided attention?
I have a lot of thoughts. I don't know things that I should say out loud.
It's a family show.
Professionally would be to look at, okay, so I'm sure you've heard of Edward Dowd.
Yes.
and his book Died Suddenly, I think it's called.
Yeah.
Something like that.
Is it? That sounds about right.
Something like that.
Yeah.
I forget what it's called, but it's a picture book almost with QR codes where you can see. And I think I would even approach it from a from a non-science standpoint. Well, I don't want to talk about, actually, you know what? No. Sometimes I actually talked to my husband about this recently because they want to say it's long COVID, right? They want to say it's long COVID. We want to say it's the vaccine. How about we meet in the middle? It's the damn spike protein. Where the hell did the damn spike protein come from? Why are we not talking about that? Why are we not talking about the fact that this is not from zoonotic origin? That there are so many factors in the sequence that they knew that somebody had their hands on it. I'd have to think of a much more delicate way of bringing that about than how I just presented it to you. But that's really where my anger lies now, is that I feel like they're pitting us, the two sides, the pro-vaxxers and the anti-vaxxers, against each other, when really we all could just meet in the middle and talk about where the heck did this come from.
Yep. And why is it that the people who are involved in brewing this stuff up were also the people who were running the response to it?
Yes.
Yeah. And why is the Eco Health Alliance still getting money from US taxpayers to do this crazy research? Yeah. Oh, so many questions.
A good book would be The Truth About Wuhan by Dr. Andrew Huff. I don't know if you've seen it, but I just finished it. And that is, he worked for Eco Health Alliance up to about 2016. And the hell that he has lived through in basically laying out what he learned when he was employed there. So anyway, that's an aside.
Yeah, it's crazy. And my final question, so prepare your tinfoil hat. Given the topics that we've touched on today, who do you think is behind all this, and what do you think their objectives are?
Ooh. Well, unfortunately, power and money is what rules the world, right? And so I think there are multiple hands in this pot, and every day there's more. I mean, even with this whole Epstein nonsense coming out in our country, the people that have a role there, and I don't know if you read about his scientific forum that he had on his island, and Stephen Hawking was there, and what was going on? So I don't think I could.
Yeah, sorry to interrupt. I would say the focus on the sex trafficking, which is vile and disgusting, but it is a distraction from what Epstein was truly up to.
Yeah, and so that is what I had read yesterday about the scientists that were, world-renowned scientists that were there.
Absolutely.
So I don't feel like I can answer the question well, because every day I feel like I learn something new that just makes the puzzles getting more put together, but the pieces that I need aren't all there to really understand the players. Yep. But I do know that our government, the U.S. government, I can't speak to Australian government, had a huge role in this. A huge role. And right here in my backyard.
Yeah. Yep. I don't know what the direct involvement of the Australian government. No, actually, I kind of do. So, if you look at videos of Event 201, you'll see Jane Halton, woman with a sort of very severe sort of blonde hairdo, sitting. I can't remember who she was sitting next to. She played a very prominent role in Event 201. So Jane Halton has occupied a number of prominent positions in Australia. She was appointed to the Prime Minister's Commission for, basically running Australia's response to the pandemic. And her husband has a senior position at the Australian Bureau of Statistics. His brother was the chief medical officer in Victoria. So,
yeah,
there's a viper's nest, and there are certain players, there are certain names that just keep popping up over and over and over again. Yeah. Like, out of 8 billion people on this planet, why do I keep seeing the same small handful of names?
Correct. That's absolutely correct. Gates, Christian Anderson. I mean, we could go on. I'm sure we could list.
Oh yeah, yeah,
You
yeah.
had a-
And I would love to go on. So we will
But you gotta
chat.
get to work.
Yeah, I'm going to get to work. We will chat offline about when we can talk again. Once again, I want to thank you for being so incredibly generous with your time. I know it's kind of getting late for you, and you probably have other things to do. But and sorry for all of my listeners who submitted questions. Jessica has read them. I wanted to delve into her history today. We will get to as many of your questions as we possibly can. So stay tuned for part 2.
Okay, two quick things. Yep. Thank you for this opportunity. You are a hero in my eyes. I talk about you almost daily to my patients and have shared some of your writings too.
It's actually really embarrassing, but I'm pleased. How did you?
It's not. It's so important. What's that?
How did you come across my? I guess it was my Substack.
Yeah,
I don't ask you this.
I thought that I was thinking that today so we could discuss it, and I have no earthly idea how I came across it. I don't even know when I started following you.
Someone or other shared a post. Yeah, that's how I've discovered a lot of
Then
people.
I was going to ask you if it would be okay, the people that ask questions that I might just go in and just respond to their questions on your subject.
Please do. Please do.
If I have time to give them an individual response. So I'll do that with some that are easy to answer questions. So.
Great. And then what we can do is kind of round up questions that are along similar lines, and any of those that you feel could do with a thorough treatment, we'll talk about those subsequently.
Because I would like to talk about sealants next time.
Oh, that came up, didn't it? Yes.
Yeah.
Yes. Okay. So there's so much yet to discuss. Thank you from the bottom of my heart. It's been such a pleasure getting to know you on a more personal level rather than just like going back and forth in the comment section. And we'll chat offline about when we can talk again.
Great. Thank you, Robin. Have a good day.
Yeah, you too. Thanks, Jessica.